Hello and welcome to the Extraordinary Health Podcast. I'm your host, Dr. Paul Beckham, and this podcast is sponsored by All Seasons Integrative Health. In today's podcast, we're going to go over uh, episode 2, which is the understanding of essential care in our office or full body chiropractic 1.0. In today's podcast, we'll be covering a detailed explanation of essential care. We'll also be going over common conditions that are treated at this level, step by step breakdowns of a typical full body chiropractic session, as well as patient success stories and some case studies here that'll be going over the benefits of essential care. We'll also go over, as an essential care expert, how essential care could help you. There'll also be some DIY tips for at home exercises and stretches. There'll also be a discussion of the frequency of visits that are typically recommended with the essential care for full body chiropractic sessions, as well as we'll be going over the integration with other healthcare professionals. So let's get started. So, a detailed explanation of essential care. Well, essential care is the foundation level of full body chiropractic treatments. With essential care, it's going to focus on basic spinal and extremity adjustments to address the immediate concerns, typically pain, inflammation that a person might have going on. It's also going to aim to establish the proper alignment and improve the overall body function by helping to restore your body's kinetic chain, as well as that proper connection neurologically from your brain to your body. Uh, this helps by including an initial comprehensive assessment here, where we're going to be looking at, like I just stated, how well is your body connected from your brain to your body. It's done through doing some muscle testing as well as some sensory testing. And especially on the motor side of things here, we're looking at how well is your brain connected out to your body, because when we do the testing, we're going to find, I guess the best term I use with people is that the muscles are inhibited. A lot of people will perceive that the muscles are weak and they think that they just need to go do some exercises to strengthen it. And it's, maybe the possibility there. But a lot of times it's more that we need to reestablish that connection between your brain and your body. When you have, a chronic pain coming on here, which is a lot of the people that are coming in for essential care. Some people will come in with an acute injury. If you have an acute injury, it's usually pretty easy to determine. I mean, you sprained your ankle or something like that. There's some swelling going on. There's some weakness. Your body is just inhibiting things from occurring because it doesn't want you to use the part that's injured. And by having pain in the area there, your body's, it's like that little red warning light going off, telling you not to use that part. Obviously, if it's really an acute injury and you've maybe torn or damaged some tissue, that's where you're going to get the inflammation going on. When people come into the office and they have more chronic problem, I mean, that's where they just can't even really perceive where the pain is coming from. And that's what we have to determine really with the exam here is what's actually causing the problem. Is it a nerve root problem? Is it a problem where the nerve roots that are exiting out of the spine are causing a neurological problem where you're not getting that proper connection between the muscles, the tendons, the ligaments, the joint capsule, the joint synovium, going back up to your brain through what are called the proprioceptive fibers, and also pain fibers that go up from there, especially with any kind of injury. And if any of that happens, your body's really good at shutting things off. Like I just mentioned, with an acute injury, you injure something, your body just automatically, sends out signals and you just don't perform those activities because it actually causes pain and probably is going to make the injury worse. Is that a good thing? Yes. I mean, you're not going to want to further damage something that's already been injured. But when it's been a chronic problem and it slowly kind of creeps up on you, or a lot of times with a lot of people, it's an old injury and it just never healed properly because you never really got it taken care of in the first place. So when we do the testing, we're going to find these muscles that are inhibited, and then that's going to end up indicating what we need to get treated here. Is it a nerve root problem? Is it a nerve problem? Or is it a muscle and tendon kind of a problem? Or is it more a bone and joint type of a problem? So any kind of neuromusculoskeletal condition is really what we're evaluating here. And we want to look at it from two different perspectives. A typical chiropractic perspective would be looking at it neurologically, and once you feel like you've gotten those nerves, cleared up, they'll be adjusting the spine. Then, and I hate to use the word, but I'm going to have to say, assume that they've gotten the condition taken care of here. But in most cases, I would say in most situations, I mean, that's why I'll have people coming into my office and they've had that done. They're tired of having to go back to the chiropractor because they get their spine adjusted. It maybe takes care of the pain, and maybe they get that connection going back and forth again, but they never really took care of the musculoskeletal problem that is peripheral to the spine. Where they could have a problem. Let's say it's a lower back condition. It might have to do with something even all the way down at your feet. But we'll get into that a little bit further later here. So once we kind of get to the problem here, we want to look at, what are some of the common conditions that can get treated in the office here. And some of those could be, as I just mentioned, they could be acute or chronic back pain. It could be neck pain and stiffness. It could be headaches and migraines. It could be joint pain in the shoulders, elbows, wrists, hands, hips, knees, ankles, or feet. It could be just postural issues that are going on with people, or even just minor sports injuries. And again, we're just talking about this uh, initial essential care here, and we'll get into some more levels of care in our next podcast here. But first of all, let's just go through here, and then we'll kind of rewind to what I was talking about before here. A step-by-step breakdown here now of a typical session in the office here. First, when a person comes in, they're going to have that initial consultation and a health history review to just kind of see what they've had going on. Is this an acute injury? Is it a chronic injury? What are we having to deal with here? Uh, does it seem like there's different types of pain syndromes? And most of the time, even when we're sitting down and just doing the consultation, it gives me a better idea of what a person has going on, even just by the words that they're using. It could be literally just a nerve-based pain, and sometimes then it's going to go along what is called a dermatomal pain pattern, where it reflects a certain nerve root that's injured. It could be a peripheral nerve root, or excuse me, a peripheral nerve pattern, something like a carpal tunnel syndrome, where you'll get numbness and tingling showing up in your hand, especially in your thumb and index and middle finger. And that's going to more tell me that you have a peripheral nerve entrapment. We might need to be doing some extremity adjustments, might need to be doing some soft tissue treatments to help get that restored. And it's not just going to come around just by adjusting your spine. We're going to probably do that too, just to make sure we get that proper nerve signal going back and forth. But we're going to want to get that, the wrist as far as the carpal bones adjusted to make sure you have the proper alignment of all those, because when those get flattened out, that helps compress that median nerve and people get carpal tunnel syndrome. And it's usually an overuse type thing where it could be a ergonomic thing at work. Could just be a repetitive stress injury. I have various different patients that are even, construction workers, working heavy equipment where they're working with joysticks and stuff like that. That'll end up causing a peripheral nerve entrapment. Or it could be, like I just mentioned, it could be the wrist bones, the carpal bones, and we'll get that all tested and find out if those are out. What's nice about doing the testing is that you can feel it for yourself. You're going to know that it's not working because you're not going to be able to do the test. And I always tell people to get to judge me and see if It's better or not right after we get it treated. And usually, if it's a peripheral problem, it's a more musculoskeletal problem, we can have almost 100% of that strength back almost immediately after we get you treated. If it's more a nerve problem, we just want to see any kind of improvement there, 10, 20%, whatever we can get, and want to see it progressively improving as we get you treated. So after we kind of go through that health history, we're going to do a comprehensive physical exam. We're going to do the muscle testing, sensory testing there. We're also going to look at your posture and gait, just what kind of static alignment you have, how well your body is moving. That muscle testing, as I stated before, patients are going to feel that it's going to help show weakness. It's not, like I say, a weakness. It's that the nerves are not getting that proper signal going back and forth between your body and your brain. So it's more a dysfunction, or just literally uh, like a circuit breaker is probably the best way to describe it to you, that has popped, and you're just not getting that proper signal going back and forth between your brain and that tissue. So after we have all that testing done, that's going to give us a better idea. Let's just assume you don't need to have any X-rays done, no other diagnostic tests. That's when we can get into literally doing the spinal or extremity adjustments to help correct the misalignments, get everything lined up properly again, so you can have the proper movement. Also making sure you have the proper stability there, because then long term, that's where we want to look at even rehabilitating it to get the proper function back. And I think this is the big thing in traditional medicine, that it's kind of just a blind spot. It's not something that they're looking at. They're going to throw physical therapy at you right away and completely miss out on the alignment, as well as that, uh, the postural alignment and the movement, and get everything correctly aligned there. And then you can combine it with physical therapy and rehabilitation, and a person's going to have a much better outcome if we get that back, rather than if you try and do some physical therapy before that. So usually right after you do the adjustments there, we can literally, like I mentioned before, just go back and retest you again. And for most people, if it's that peripheral tissue, that more musculoskeletal tissue, you'll have almost 100% of that strength back right away. The other thing that we'll do is we'll also give you some at-home exercises to help get that proper alignment back. So there'll be some things you yourself can be doing at home, as well as giving you some exercises to start to build some stability. And once we get to that point where we've got the proper alignment back and the proper range of motion, then we're going to look at getting that proper function or strength back then too. So let's kind of move on to some patient success stories and testimonials here. I have one patient, just say John D. He said, after he had 3 essential care sessions, his chronic lower back pain decreased significantly. I would say that's pretty typical of the patients that come in our office. It's probably somewhere around 2 to 5 visits, and you're seeing some pretty significant pain reduction. We're always shooting for at a minimum 50% reduction within 4 weeks. I would say typically we're seeing about 80% though, maybe more, but it's pretty much about what we are typically seeing. Sarah M. She also stated that, I noticed improvement in range of motion in my neck and shoulders after my first visit. Kind of like I stated before here, too, is that you're going to notice a difference right after you get treated, because we'll even check the strength again right away. And what we should see is those muscles should lock in position. It's hard to describe to you, but once you have it done and get it done repeatedly, you kind of understand. It's a good way of knowing whether or not what we did for you helped that day or not. When I'm doing those tests, we have computerized tests that we also do with people here, to measure their function, to measure their posture, to measure the stress on their nerves and muscles, thermography to measure inflammation, all that sort of stuff. But once we're doing those tests on a daily basis here, I'm going to know that you're going to be better when you get those things retested. It's just a matter of, we use those just to make sure that, when you first come in, we'll get a baseline with you as you get treated. Typically, you get retested every month after a person gets treated, and make sure that you're getting better. Because if you're not, we want to adjust your treatment so that you are getting better. One more person, Michael R., states that, essential care helped me get back to my daily activities without constant discomfort. And that could be, anybody with, chronic headaches, chronic lower back pain, chronic neck pain. It's getting back that quality of life. I think that's what a lot of people are looking for. And, we can do that for, people that have even significant arthritic conditions going on. And there's other things that we'd get into, probably more in the next level of care, which we'll talk about in the next podcast here. Because right now we're just kind of talking about the basic essentials that most people are going to need. Probably the younger individuals or the people with just minor injuries. But yeah, we'll kind of get onto that. In fact, that's the next section here. A case study kind of illustrating the benefits of essential care here. So we had a patient who was 35 years old. They were an office worker. They were having recurring neck pain and headaches. They had treatment. It was 6 weeks with the essential care. It included spinal and extremity adjustments, as well as some postural corrective exercises. Well, the result was that they had 80% reduction in their headache frequency, improved neck mobility, and just better overall posture. So, for an essential care specialist, the big thing here is that to understand, what we're doing. I mean, full body chiropractic care, I would consider in our office as one component of the whole overarching functional physical medicine that we perform in the office. And this is where it's going to differ from a typical chiropractic office because a lot of the chiropractic offices are geared towards pain and, getting things adjusted so that the pain goes away. But we want to go a little bit deeper and we want to find the root cause of your problem and deal with the correct posture. That could include x-rays so we make sure we get the proper alignment back of your vertebra. And we measure all that stuff too to make sure that we get it as close to where it should be at as possible. So that long term, you're not going to have the misalignments occurring again here. The closer we get you to the normal where it should be out there. And there's things we'll have you do at home as well. But the less chance you have of having things like neck pain and headaches coming on, if it was your neck or even your lower back, chronic lower back issues going on, because the closer we get that alignment, then we can start to strengthen things up from that functional standpoint. And whether you do rehabilitation in our office or you're already working with somebody physical therapy wise, a trainer or something like that, we can make sure that you're doing the things that are going to help strengthen and improve your function so that you have the best quality of life you can live. Again, other big things here, just the long term benefits are we're looking at getting the correct alignment of everything back, not only to your spine, but also to your entire body. People can even see it in their posture pictures that we take of them. You can see where their shoulders, when they come in, they might be rounded. And as soon as we get all those adjusted, we might have to adjust the shoulder blades, the rib cage, the collarbones. I mean, whatever it happens to be, there's tests that help point this out. And again, you'll not only be able to see the difference, but you'll be able to feel the difference as you're getting treated. So, what are some tips or some at home exercises and stretches here? So, things that you can do are like neck rolls. You're going to slowly roll your neck here so that you feel where the muscles are getting tight and just let those muscles just stretch naturally there and keep, rolling from one side to the other side there. But don't do it to a point where you feel things crunch or pop, which is fine. But if there's pain with it here, we want to go up to pain, really not into it here. So you're feeling that stretch. So you're going up to that point and not going further because we want to slowly get these tissues stretched out. If it's muscles, they're kind of like rubber bands. You can get them stretched out there, but you're going to have to keep stretching them probably every day until you get that proper alignment back. Because the reason why they are stressed is because you just don't have the proper alignment of the joints underlying them. Other stretches you can do are like a cat cow stretch, which is just good for overall spinal flexibility. So you're on your hands and knees on the floor, you arch your back up like a cat, and then you slowly lower it down so it's kind of sagging down like a cow. and go back and forth. So trying to hold those stretches for 3 to 8 seconds in each direction there. And that can help add some mobility and flexibility through especially your lower back, mid back, and even with your neck, because you want to slowly even move your neck through that whole range as well there. Hamstring stretches are really good as well. Uh, I'll have people, and a simple exercise here, especially to get some lower back pain to go away as well, is to sit like in a dining room chair. And this is not your hamstrings directly here now, but you're going to bend forward and try and touch your toes. Hopefully, you can touch your toes. So once you're able to touch your toes, I want you to even then grab your toes. And the next thing I want you to do is try and lift your butt up off of the chair while you're holding onto your toes. If you can't do that, you probably have some pretty significant restrictions there. If it's just impossible and you try it for a while, it's probably time to just come in, get some things assessed to see exactly where you're at, see what kind of treatment is maybe necessary to help out. Maybe you can just continue doing some exercises at home, but more than likely you probably have something that needs a little extra help to get that better there. Other things you can do is just core strengthening exercises to improve your posture. One exercise that I'll have people do, because a lot of people have hip flexor muscles that are weak, that are causing more anterior pelvic tilt, is that we'll have them use something like a playground ball, or if you have an exercise ball at home, you're going to lay on your back on the floor. You're going to put that ball down by your ankles, and you're going to squeeze it between your ankles. That's going to help activate your adductor muscles on the inside of your thighs. And then you're going to try and lift your legs up in the air, hopefully getting up to at least 90 degrees. So they're going straight up and down in the air, and then slowly lower that ball back down. And once you're unable to do that, whether that be one repetition, 3, 10, if you get up to 20, you can probably stop there. But that'll start to help strengthen some of the muscles that need to be strengthened in your back. Again, it would be best to come in the office to get assessed to see exactly what you have going on so we can give you very specific exercises to your condition. But these are very good, just general exercises that shouldn't really hurt you, because if you do feel pain with any of the exercises, you should stop and not perform them anymore. Other big thing is to look at the proper ergonomics of a workstation, whether that be at home or at work, to make sure you maintain the proper alignment of your neck, your upper back, and your lower back. A lot of people tend to get that tech neck now, where their head starts to kind of poke forward, and then that starts to give more neck and shoulder pain. If it gets shifted forward far enough, that's where you can even start to irritate the nerve roots right where they're exiting out of the spine. And then that ends up causing a radiculopathy out in your hands. And sometimes it goes down to your hands where they get numb and tingly. People think they have a carpal tunnel syndrome going on. They may or may not. Again, we'd have to evaluate that to determine. But a lot of times it's because you're just stretching, you're actually pulling your spinal cord kind of tight against your spine and even tensioning it as it goes out to your shoulder and down your arm. So there could be some postural exercises that we could have you do, or you might even need some correction as far as the posture goes. You might need some adjustments to help get that head and shoulders and neck back there. A lot of people, their shoulder blades get thrown off as well. So just getting that assessed and see if that's what we need to do, and then add in some exercises to help strengthen those areas as well. So that kind of moves us on into the frequency of your typical visits here. And in the initial phase of people coming in, it could be coming in 2 to 3 times a week. Depends on if they have more chronic or acute type problems. If it's more chronic, it's probably a couple times a week. If it's more acute and it's more painful things going on, you're going to be on that 3 times a week range there. And that could go on for about 4 to 6 weeks. And once that starts to improve, then we're looking at about 1 to 2 visits per week for the next 4 to 8 weeks. So could be a typical program, and again, it could be less, it could be more. Uh, that's really dependent upon when you come in. We'll give you an assessment and let you know what we think it's going to take, and obviously we adjust it as you go through care as well. So people, after they get done with that, it really depends what they have going on. Some people will move on to a maintenance or a wellness phase, where they'll come in. once or twice a month, kind of, or as needed. Typically, we'll even have people just schedule out if they're going to do an as needed type situation to just get an annual exam just to make sure things aren't backsliding on them. And, if they are, we can get them going on some exercises again to help, prevent the problem from coming back again. Or if they do need care, they can get back in. Typically, it could be a few visits, one or two visits. It may be more depending on what's going on. But we want to keep you on track here because we want to help you finally feel good and live your full potential. And we'll kind of move on here. The other big question that we'll get from people here is, how does this work with other healthcare practices? And just to give an idea here, I mean, let's just say you're already working with a physical therapist. You can come into the office and, we can work on, like I say, some of the basic stuff here and get that proper alignment and movement and stability back for you there. And then they can start to work more on the functional aspect of things here to help regain the proper function after that. Or if you choose, you can always follow through on our office and we can do rehabilitation with you as well to make sure that you're getting that proper function back. And long term, you're not having this condition come back because now you have ways of even maintaining it at home because we'll give you home exercises as well. We can also coordinate with a massage therapist if you're going to a massage therapist, just to make sure that we're enhancing, just the soft tissue benefits of things. We also do have soft tissue things that would kind of get into the next level of care, which we'll go over in the next podcast here. Uh, but we're typically dealing with a lot of fibrotic tissue at that point in time, whereas massage therapy is a good thing to have done on a regular basis as well, just to keep that proper blood flow, keep the muscles relaxed, keep the muscles pliable. They can continue to work with you just to make sure everything is functioning well as far as the soft tissues go. If there's significant things like arthritic joints or past injuries or past surgeries, we do have, I would say it's a continuum of care here from things as basic as massage therapy, moving into some instrument assisted therapy to a little more sophisticated uh, shockwave therapies, where the basic one is a mechanical shock wave, or also known as an RPW or radial pressure wave, which is really good at breaking up scar tissue. And then we can get into our electrohydraulic shockwave therapy, but we'll talk about that more in a future podcast here. I think the next one here is just nutritional counseling, and that's a part of your initial paperwork here in the office. And we can just get into some of the basic things that might help deal with pain and inflammation, muscle relaxation, get into basic nutrition just to make sure that you're taking what you need to, just keep your body from getting worse, making sure you have the proper vitamins, minerals, phytonutrients, amino acids, essential fatty acids, so that your body can heal and repair itself and also then be able to maintain itself more on a wellness type basis ongoing. Other things to kind of think about here as well are mindfulness and stress reduction techniques that can help out significantly. I know I've used several different apps. One of them is called Calm, is a very good app to use. Right now, I've also been using another app. I'm gonna pull that up here. That's actually called Waking Up. That's been just a different meditation app to get into here. They'll teach you. You don't need to know anything at all about meditation, and they can literally, teach you how to do some meditation, which can help in just relaxing and giving you a little bit more of awareness of how your body's functioning. There's another app that's really good that teaches you some breathing techniques called State. And some of the other apps do that as well, but State has some good just breathing techniques so that it's geared towards your ability. So they'll test you and find out just what you can do, and then you can see yourself improve as you go along with it. So Let's see. Also, we can coordinate with your primary care doctors there, so you can get just comprehensive care. I mean, I have some primary care doctors that we've worked with here that'll do things like PRP injections for arthritic joints. Um, we can get into IV therapies and stuff like that that could help out as well with other various things. Typically, not at this level of care, more into probably some of the higher levels of care. Another thing that we could also look at in the office here too is if you had lab work done with a primary care physician, they're looking at it, is there medications that you need to be taking, or is there any further advanced diagnostic testing or surgeries that you might need to be looking to at? But we can look at them from a functional medicine standpoint and get into some very specific nutritional things that might be beneficial for you. Uh, that might even help stave off needing to take medications or uh, result or have to go and have some kind of a surgery or something like that. So that kind of wraps up today's podcast here. Hey, stay tuned and follow us next week here. Our next episode, episode 3, is going to be on enhanced care, or what I would call full body chiropractic 2.0. That's a little bit more of a deeper dive into of the things that we're doing in the office. If you do have any further questions or anything like that, you can always reach out to us and give us a call here at 701-356-0016, or you can go to our website at www.allseasonsintegrative.com. And there's tons of information out there. If you want to schedule a consultation, you can schedule a consultation out there, or schedule a new patient exam so we can evaluate you and see what you might have going on and let you know how we can help you so you can finally feel good and live your full potential. I hope this information helps, and can't wait to see you in the next podcast. Thanks again.